The U.S. has recorded more than 100,000 new coronavirus cases each day over the last 2 weeks. More than 11.3 million cases have been confirmed nationwide, and more than 248,000 people have died. Hospitalizations are also surging, pushing many facilities to their limits. The rise in cases has led officials in at least 28 states to tighten restrictions. CBS News correspondent Carter Evans shows us some of the new measures.
Those windows right behind me there are part of the intensive care unit, and right now they're at 140% capacity here. That means they're using regular hospital beds as makeshift ICU beds. It's happening across the country as states clamp down to slow the spread.
We are in a war right now, and the virus is winning.
One by one, leaders in cities and states are sounding the alarm. In Ohio,
we are issuing a curfew Thursday at 10 p.m.
The Northeast.
A second wave that's trying to assault New York City.
The Midwest.
It is spreading right now every chance it gets in Chicago.
Anything to get the public to take warnings from health experts seriously.
It is the real thing, and it is eating us alive.
Iowa's governor, who once said mask mandates are just feel-good measures, is now making masks mandatory starting today.
If Iowans don't buy into this, we lose. Businesses will close once again.
As lines to get tested stretch for hours at LA's Dodger Stadium and outside a Massachusetts hospital, home test kits are being delivered in hard-hit El Paso by drone. And more health experts tonight are warning it may be time to cancel traditional Thanksgiving plans.
If you have in your family vulnerable individuals, to ask yourself, for this particular holiday season, do you really want to take the risk?
New Orleans is not taking chances, canceling Mardi Gras parades for the first time in 42 years.
Call bells are not being answered. There's a human being behind that call bell with a need, okay? And I have heard call bells ring for a half hour.
This chart shows how fast hospitalizations are rising in Utah, a nightmare, not just for those infected with coronavirus.
I want her back and miss her terribly.
When Stephanie Deer's sister had a heart attack last month, she needed critical care at a trauma center.
The first thing the doctor told me is, we're trying to find a way to transport your sister, and we can't find a room because of COVID.
Lori Pratt-Terry was just 47 years old when she passed away. She shared a lifetime of memories with her sister and leaves behind her husband and 9-year-old son Griffin, seen here at her funeral.
If they'd been able to get her to that hospital faster, would she be here today?
Yes, she would be here. I know that what happened to her was survivable.
There are people who still believe this is a hoax.
Whether they believe it or not is irrelevant, and the chances of them not being able to be treated are high right now, very high. And I don't want that for anybody, regardless of what they believe. COVID is the reason that my sister died, and she didn't have the virus.
The need for more medical professionals is also a big concern. New data from Health and Human Services suggests that more than a fifth of hospitals in the country that can take COVID patients are expecting a staff shortage this week. Elaine?
Carter Evans, thank you. For more on this, I'm joined by Dr. Amesh Adalja. He's an infectious disease expert as well as a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, thank you very much for being with us. We are seeing different states take different measures to help curb the spread of COVID-19. Is that an effective way of controlling the virus, or do we need a more unified approach across the U.S.?
Well, we do want to have a unified approach so that you don't have states sort of doing things different, and they may be adjacent states, and it just becomes very hard for the public to understand why certain things are happening in one state but not in the other. But ideally, what you want is targeted public health that's based on the epidemiology. So if there are certain events or certain activities in a given state that are causing cases to rise, that's where you want your public health actions to be. But we do need to have the CDC playing this coordinating role, and they've not been able to play that from the very beginning of this pandemic. And I think that's why you have this non-uniformity and things shifting and changing, and people being a little bit not quite understanding exactly what metrics are being followed. But I do think as we enter this very difficult time with this virus, we are going to need to do targeted public health to keep our hospitals from going into crisis. Hopefully that will be something that's apparent to the public, because we need them to actually listen and actually change their behavior in a way that decreases the spread of this virus.
You know, I want to ask about children, because new data from the American Academy of Pediatrics shows that more than 1 million children have been diagnosed with coronavirus. What is contributing to that number? And what are some steps that parents can take to actually keep their children safe?
Well, we know that this virus can affect children, and thankfully they're not represented among those who get hospitalized or who die. There are some individuals that get complications, but it is true that children are getting infected. And if you look at the epidemiological data, it's likely more households and extracurricular activities. It doesn't seem to be being driven by the schools that have opened, but sometimes it's activities that are occurring outside of school. There may be some youth sports leagues where this type of thing is happening, and people just letting their guard down because they think that children, because they haven't been hospitalized, are really spared from it, which isn't necessarily true. And I think that there's still a lot of mystery to children and their role with this virus. It doesn't seem that they are major epidemiological drivers, meaning spreading it too much or driving the infection, but they can be infected, and they can in certain circumstances spread it, and they can also have some complications on occasion. But this is going to be a key question that needs to be answered.
Doctor, you broke up a little bit on my end. I'm not sure, hopefully our viewers were able to hear that. But what I hear you saying is that we're still waiting on more research. But at this point, it does not appear that children, you said, are necessarily at that same level of risk as other population groups. Is that right?
Right, and that may be why parents may not take the same precautions to keep their children safe, because they hear that and they don't really teach their children about face coverings or to wash their hands, and they often enroll them in certain activities where there might not be social distancing being practiced. And I think that's likely what's driving it. It doesn't seem to be in schools that have opened, for example, in New York City. They don't seem to be getting infected at school, but it's the extracurricular activities, maybe around school or with school friends, that are driving infections.
So both Pfizer and Moderna report that their coronavirus vaccines are more than 90% effective. What are the next steps in getting these vaccines out to the public, and when will most people be able to get vaccinated?
The next steps are the emergency use authorization, and we've heard today that Pfizer has reached its safety endpoint and is now submitting for an emergency use authorization. I suspect Moderna will be a couple of days behind. Then the FDA has to go through that process to determine how safe and effective these vaccines are, and if everything goes well, and I think it will, it becomes an issue of scaling up production for tens of millions of doses, at least initially, and then developing a distribution network to get this vaccine into the arms of the highest priority groups, which are going to be healthcare workers and high-risk individuals. And that's going to be the major challenge, especially because the Pfizer vaccine does require extremely cold storage temperatures, which are going to be hard to achieve. This is really going to be a major task, and I do think that for the general public to get the vaccine, we're looking at well into 2021, maybe in this late spring, summer of 2021, before vaccine kind of rolls to the average risk person.
And what do we know, doctor, about possible risks to these vaccines?
Well, we've seen safety data from phase 1 and phase 2, as well as animal studies, and they seem to be fairly safe. Obviously, we're not going to have a full safety profile when an emergency use authorization is issued. And anytime we have a vaccine, we follow people who get vaccinated for years to know the long-term consequences. We won't have that luxury, and we can't have that luxury because we're in the middle of a pandemic. But I do think from what we've seen so far that these vaccines do seem to be safe, and most of the reactions we're seeing so far are just injection site reactions, fevers, muscle aches and pains, some soreness where the injection occurred. Nothing serious has come out of the trials, at least to date. But it will be important that we have a full capture of all that data, and we're very transparent with the public about what the side effects are and what their frequency may be.
Well, of course, Thanksgiving is next week. Dr. Adalja, what is your advice for safely celebrating the holidays this year?
It's going to be very difficult because we know that we have an uncontained outbreak all over the country, and these small gatherings are where people let their guards down. So I do think if you can limit your Thanksgiving to your own household, that's ideal. But if you can't, or if you don't want to, just remember that the virus is likely going to be sitting around the table with you. So you need to try and do as much as you can to minimize the harm it causes by having people sit 6 feet apart, having people have their plates kind of not serving themselves, but have it all kind of plated out as almost like in a restaurant, so so that you have less mixing. Try to keep people in pods. If one household is coming, try to keep them separate from other households. If you can do it outdoors, if you can open the windows, if you can get people to wear face coverings when they're not eating or drinking, all of that would be really helpful in trying to decrease the risk. Also, if tests are available, tests can decrease the risk. It's not going to be ironclad, but it can decrease the risk somewhat. But this is going to be challenging, and many people are not going to be able to follow all of this guidance, and I fear that we will see an upswing in cases after Thanksgiving.
All right, but some really important guidance that you've provided to us today. Dr. Amesh Adalja, doctor, thank you very much.
Thank you.